Most people over 65 have it in their kitchen right now. They use it every single day, and they have absolutely no idea it could be quietly working against their kidneys. I'm Dr. Eleanor Hayes, an internal medicine physician, and after 20 years of treating patients just like you, I can tell you that what I'm about to share is one of the most under-discussed conversations happening in medicine right now. Today, we're talking about salt, specifically how your relationship with sodium needs to change after 65, and why what was perfectly fine at 40 may not be fine anymore. But here's the framework I want you to hold on to. It's something I call the aging threshold. Your body at 65 is not a slower version of your body at 40. It's a fundamentally different system. Things that your kidneys, heart, and blood vessels once handled easily, they now require real effort. And when we push past that threshold repeatedly, silently, through everyday habits, the damage accumulates long before any symptom appears. That's what makes this conversation so important. And that's what we're going to unpack today, point by point. Stay with me. Because by point 4, most of my patients tell me they finally understand something their doctor never had time to explain. Your kidneys age faster than you think, and salt accelerates it. Here's something that surprises almost everyone. By the time you reach 65, you've already lost somewhere between 20 and 40% of your kidney function, even if you feel completely fine. That's not disease, that's normal aging. The kidneys filter your blood, they regulate fluid, they balance minerals. The medical term is age-related nephron loss. Nephrons are the tiny filtering units inside your kidneys, and it happens quietly. When your kidneys were working at full capacity, they could process a high-sodium meal without much trouble. They'd simply excrete the excess. But at 65, with reduced filtering capacity, the same salty meal creates a very different situation. Your kidneys have to work harder. Blood pressure rises. The small blood vessels inside the kidneys face increased strain. And over time, meal after meal, that strain adds up. Research published in leading nephrology journals consistently shows that high sodium intake is one of the top modifiable risk factors for accelerated kidney decline in older adults. Modifiable. That means you have real power here. Think about that evening routine. A bowl of soup from a can, some crackers. Think about that evening routine. A bowl of soup from a can, some crackers, maybe a little cheese. That single snack can contain over 1,000 milligrams of sodium, nearly half of what many guidelines recommend for older adults in an entire day. Not because you're being reckless, simply because the sodium is hidden, and we'll come back to exactly where it hides. The I don't add salt myth, where sodium is really coming from. I hear this constantly in my office. Dr. Hayes, I never add salt to my food. I'm careful, and I believe them completely. The problem is, the salt shaker on the table is almost irrelevant. Research consistently shows that roughly 70% of the sodium Americans consume comes not from home cooking, but from processed and restaurant foods. Packaged bread, deli meat, salad dressings, canned beans, even breakfast cereal and cottage cheese. This is where the aging threshold becomes particularly unforgiving. Because if you're making healthy-sounding choices, whole grain bread, a turkey sandwich, a bowl of vegetable soup, you could easily cross 500 milligrams of sodium before dinner without ever reaching for a shaker. A patient comes in with elevated blood pressure. Their diet seems reasonable, but when we go through their log together, the hidden sodium is staggering. Here's a simple habit that changes everything. Start reading nutrition labels, specifically the sodium line, on everything packaged, not the calories. A product with less than 140 milligrams of sodium per serving is considered low sodium. That's your benchmark. Shop by that number for just 2 weeks, and most of my patients are genuinely shocked by how much sodium disappears with very little sacrifice in taste. Why high blood pressure and kidneys are a dangerous loop after 65. Here's what most doctors don't have time to explain in a 10-minute appointment. High blood pressure damages kidneys, and damaged kidneys raise blood pressure. It's a cycle, and once it starts, it reinforces itself. When sodium intake is high, the body retains more fluid. That extra fluid increases the pressure inside your blood vessels. Your kidneys, already working harder with age, are now filtering blood under greater force. That force damages the delicate filtering structures over time. And here's the part that gets missed. As kidney function declines, the kidneys become less effective at regulating blood pressure. So pressure stays higher, which damages the kidneys more. Studies found older adults are more sodium sensitive. The same salt produces a larger response in someone over 65 than it does in someone at 35. That's not a reason to feel alarmed. That's a reason to feel empowered. If your blood pressure is more responsive to sodium, it's also more responsive to reducing it. For many of my patients, thoughtful sodium reduction combined with other lifestyle steps produces meaningful blood pressure improvements without any medication change. Always work with your own physician, but understand that this lever is real and it's in your hands. The medications that make sodium even more dangerous after 65. Stay with me because this one surprises almost every patient. Many common medications taken by adults over 65 interact directly with how your body handles sodium and kidney function. NSAIDs, that's the category that includes ibuprofen and naproxen, common over-the-counter pain relievers, can reduce blood flow to the kidneys and impair their ability to regulate sodium. Using them regularly, especially in combination with a high-sodium diet, significantly increases strain on aging kidneys. Certain blood pressure medications protect kidneys when sodium is controlled, but that protection is reduced when sodium intake remains high. I'm listing these because the aging threshold applies here too. Your body at 65 is managing more variables, and sodium is one you can control. The practical takeaway: if you are taking any regular prescription medications, ask your doctor specifically how your sodium intake may interact with them. That single conversation can be genuinely eye-opening. Potassium, the nutrient that protects what sodium threatens. Here's the other side of this story, and it's a hopeful one. Potassium and sodium work in opposition. Where sodium raises blood pressure, potassium helps lower it and supports kidney function. The foods richest in potassium are also among the most protective foods you can eat. Leafy greens, sweet potatoes, bananas, avocado, white beans, and salmon, among others. Most adults over 65 are not getting enough potassium, not because they're ignoring vegetables, but because the standard Western diet is simply built around processed food, which is high in sodium and almost entirely stripped of potassium. Instead of only focusing on what to remove, focus equally on what to add. Build your plate around whole foods naturally rich in potassium. One important note, and this is where your personal physician matters. For some people with existing kidney disease, high potassium intake needs to be managed carefully. Please discuss your specific situation with your own doctor before making significant dietary changes. Hydration, the simple factor most people over 65 get wrong. Here's something I want you to hear clearly. Dehydration is one of the most overlooked contributors to kidney stress in adults over 65. And it makes everything we've discussed today significantly worse. As we age, the thirst mechanism becomes less reliable. You may simply not feel thirsty, even when your body needs water. Your kidneys, already working harder with age and managing higher sodium loads, rely on adequate hydration to flush waste effectively. Your kidneys, already working harder with age and managing higher sodium loads, rely on adequate hydration to flush waste effectively. When sodium intake is high and hydration is insufficient, kidney filtration becomes sluggish. Waste products accumulate. The concentration of minerals in the blood rises. And over months and years, the cumulative strain shows up in lab work, often before any symptom appears. The research on hydration and kidney function in older adults points consistently toward one recommendation: don't rely on thirst as your guide. Build deliberate hydration habits instead. A simple target that many of my patients find manageable: 6 to 8 glasses of water spread throughout the day, not all at once, consistently. Nuance: if you're reducing sodium, your body's fluid regulation improves. Less sodium means less fluid retention and often better energy. These things work together, the healthy foods that are quietly the biggest offenders. I saved this for near the end because it genuinely surprises people. Bread, not white bread, all bread, including whole grain, sourdough, and multigrain. A single slice can contain 150 to 200 milligrams of sodium. 2 slices for a sandwich, you're already at 400 milligrams before you add anything. Canned tomato products, sauces, paste, diced tomatoes frequently contain 400 to 600 milligrams per half-cup serving. Low-fat salad dressings often have more sodium than their full-fat counterparts. Manufacturers add salt to compensate for flavor. Instant oatmeal packets, marketed as heart-healthy, commonly contain 200 to 300 milligrams per serving, versus nearly zero in plain rolled oats. Cottage cheese can contain 400 milligrams of sodium per half cup. These foods are not dangerous at 40, but the cumulative effect at 65 is real. The solution is not deprivation, it's awareness. And once you know where to look, you can make meaningful substitutions that add up to significant protection. Before I close, here are 3 questions worth bringing to your next appointment. 1. Based on my current kidney function and medications, what's a realistic daily sodium target for me specifically? 2. Is my potassium level in a healthy range, and would adjusting my diet affect it? 3. Are any of my current medications affecting my kidneys or my body's sodium balance? These questions open the kind of conversation that a standard appointment rarely gets to, and the answers can guide the choices you make every day. Your kidneys are working for you right now, quietly, continuously, without asking for anything. After 65, they deserve a little more consideration than we typically give them. Not through fear, not through drastic restriction, but through awareness of where sodium hides and of the real power you have to influence your own health. That's what the aging threshold means in practice, not limitation, just a new level of understanding and a new set of choices. If this video helped you, please subscribe. You deserve to understand your own body at every age. Take good care of yourself. I'll see you in the next one. This video is for educational purposes only and does not replace personalized medical advice from your own physician. Please consult your healthcare provider before making any changes to your diet, medications, or treatment plan.